Hello, everyone. Thank you for joining today's webinar, COVID-19, Shaping Social Policy Interventions to Support People Living with Mental Illness and Substance Use. It's 12:30 now, so we're just going to jump right into the broadcast. I would like to begin by acknowledging that today's webinar is broadcast on the unceded, traditional, and ancestral territory of the Musqueam, Squamish, and Tsleil-Waututh nations. I would also like to quickly credit our previous webinar presenters, Jenny Morgan and Vanessa Bursick, for the slides you see in front of you. Now, before we launch into the content of today's webinar, I would like to point out a few features of the technology we'll be using and quickly run through the agenda. First of all, there are two options for sound. You can listen with your computer's audio or dial in by telephone. If you find that you're having difficulties with one audio option, please consider switching to the other one at any point. A friendly tip: if you choose the telephone option, a landline is preferable to a cell phone and will result in clearer sound. Second, we'll be recording today's session and posting the video online at getloudbc.ca and distributing it by email the following week. Third, after our CEO's opening remarks and the panel discussion, there'll be an opportunity for audience members to ask questions. Please type your questions into the questions section of your panel to the right. You can do so as soon as they occur to you. The sooner the better. I'll collect questions throughout the webinar and read them out to panelists during the Q&A period in the order I receive them. If you would like to address your questions to a specific panelist, please make a note of this in your submission. We'll try to get to as many of your questions as possible before the end of the webinar. Okay, I'll now turn it over to our CEO, Johnny Morris, for his opening remarks.
Well, thanks so much, and thanks for your patience just with those technical difficulties. Hopefully you can see me and hear me okay. My name is Johnny, and I'm the CEO at the Canadian Mental Health Association, and feel so humbled and privileged to be able to provide some brief opening remarks for today's webinar. This morning I'm calling in from the territories of the Squamish, the Tsleil-Waututh, and the Musqueam peoples, the unceded territories of those peoples this morning, and do that with humility and appreciation, given the important topics that we're going to be covering this morning. The webinar that we've convened today and the panelists that you're going to meet shortly represents a very, very important dialogue and conversation with regard to the impacts of COVID-19, the pandemic, upon a range of issues, including mental health and well-being. And I think what many of us in advocacy and nonprofit organizations and in decision-making roles within government and also people with lived experience are noticing, and that's that the pandemic is demonstrating and bringing into relief a sharp experience of inequity in many, many ways, including for people living with a mental health or a substance use problem at this very extraordinary and difficult time. This webinar is an important opportunity to hear from our wonderful, skilled, expert guests today about the impact of COVID-19 on the mental health, use of substances, and well-being of people who are already living with an illness in the communities and constituencies that their organizations serve. And the profound importance of policymakers, and we're very grateful that on the line today we have policymakers, decision makers from a range of decision-making bodies, including government, alongside us today, to listen in on the updates, the observations, and the information from across these intersecting groups of people that we collectively serve and represent. Right now, I think many of us are grappling with an uncharted reality. We are experiencing hope at the same time as profound uncertainty. Many of us experience privilege and great luck within the circumstances that we occupy, and we sit alongside folks who experience tremendous hardship, profound concern and anguish and difficulty, including housing, food, income precarity, and insecurity. And of course, we're in the midst of a multi-layered pandemic. We're all needing to and are still grappling with the ongoing effects of an opioid poisoning emergency, public health emergency too. Right now, what's happening has opened a window for dialogue, discussion, planning, and ensuring that as things start to hopefully improve on the horizon, that we don't lose opportunities to course correct and do right when it comes to inequity, health inequities, and building a mentally healthier future for the people we collectively serve. Thank you very much indeed for joining us. I do really much to want to indicate my appreciation for Amelia's leadership in convening this webinar, and on behalf of CMHA, thank you for joining us today. And I'm going to hand it back to Amelia to get us underway with the panel. Back to you, Amelia.
Thanks, Johnny. I really appreciate your remarks and for setting the tone for our discussion today. Before I introduce our panelists, I'd like to add a bit of context for our discussion. So no one here needs further reminder of what's going on beyond this broadcast. As Johnny mentioned, the impacts of COVID-19 are ongoing and constantly changing. And in response, we're seeing a tremendous amount of policy being rapidly rolled out at all levels of government. There are income supports, ranging from wage relief for workers to crisis supplements for people receiving income assistance to salary top-ups for essential workers. Housing and homelessness initiatives such as rent subsidies, rent and eviction freezes, and repurposed spaces for those who are homeless or at risk. Family support and childcare, including increases to the Canada Child Benefit and grants for families with children with special needs. And lastly, systems level investments. Funds are flowing to organizations who are providing support to vulnerable citizens, from food banks to women and sexual assault shelters to Indigenous communities. The list really goes on. These are only just a few examples. The pace and amount of policy change is staggering and requires critical reflection. We need to examine whether or not these policies and programs are meeting the needs of the people they're intending to help, and if any people are being left behind or unseen. Today's discussion will examine supports available to people living with mental illness and substance use, specifically looking at income, housing, and community funding. I'm very pleased to introduce our panelists who will be leading this discussion. Doug King is the Executive Director of Together Against Poverty Society, otherwise known as TAPS. The Victoria-based nonprofit provides legal advocacy services to people with income assistance, disability benefit, and tenancy issues. A lawyer by trade, Doug previously worked for the Downtown Eastside Residents Association and Pivot Legal Society. Throughout his career, he has advanced human rights with particular attention to issues related to police and private security accountability, mental health, access to social services, and housing. Welcome, Doug. Chris Livingstone is a member of the Western Aboriginal Harm Reduction Society in Vancouver's Downtown Eastside. Their mission is to improve quality of life for Aboriginal people who use illicit substances by encouraging the development of support, education, and training programs that reflect the values of Aboriginal people. He also provides mental health outreach and peer coordination for the Vancouver Aboriginal Community Policing Centre. Welcome, Chris. Minachki Minot is a campaigner for Pivot Legal Society. She works alongside her interdisciplinary colleagues to envision intersectoral approaches to policing and criminalization. All of her work has an uncompromising commitment to the expertise and vision of people with lived and living experience and spans public legal education materials, policy analysis, community engagement, and coordination of speaking events. Welcome, Minakshi. Last but certainly not least is Erin Pritchard, who is the Executive Director, Programs and Policy at Disability Alliance BC. Another member of the Law Society of BC, Erin has dedicated her legal practice to poverty reduction. She has represented clients before various courts and tribunals, worked and volunteered for legal nonprofit organizations, and has sat on the PovNet board since 2013. Welcome, Erin. Now that we're all in the same virtual room together, we can start the panel discussion. My first question is for Erin. How has the pandemic impacted people who are living with a mental health or substance use related disability? We're not able to hear you, Erin, if you're able to unmute your mic.
Yeah, sorry, can you hear me now?
Yes, perfectly.
All right, thanks, Amelia, and thanks everyone for joining us today. So first of all, and Amelia and Johnny both touched on this as well, but I think it's clear that the pandemic has and is going to continue to have a widespread impact as we're dealing with issues like increased unemployment, social isolation, and many other changes in the way that we live. It's definitely taking a particular toll on many people living with mental health or substance use disabilities. And of course, everyone's experiencing that a little bit differently. The changes have been really abrupt, and they're an extreme version of life events that we know to be risk factors for anxiety, depression, and self-harm. And the uncertainty in terms of when all of this will end and how long restrictive measures will be in place makes all of that a lot more difficult. So for people that we work with mental health and substance use disabilities, we're seeing the impact of intense social isolation and being cut off from supports that people usually rely on, whether that be friends and family, in-person advocacy and support services, or even gathering places like libraries and community centers. And that can put people at major risk. We're hearing that many people with pre-existing mental health conditions are experiencing worsening symptoms, and some people are developing new conditions. So for example, we're hearing from folks who are experiencing major increases to anxiety and depression in particular due to self-isolation and distancing, loss of normal routine, difficulty obtaining basic necessities like food, medication, cleaning supplies, and of course, fear about the virus itself. And so specifically for people who use drugs, we know that the dangers associated with using alone, and that's of major concern as people are isolating due to the pandemic. And substance use might also increase during lockdown. And on top of that, people who do harm reduction work are having to change how they do their work. And if emergency services are stretched, they may be slower to respond to 911 calls. And lastly, I would say that since many medical appointments are being conducted remotely, people who don't have access to a phone or the internet or are unable to use that technology without help may not be getting the help that they need. So I think it's fair to say we don't yet know what the extent of the long-term mental health impacts of the pandemic will be, since we haven't collectively been through anything like this before. And of course, it's not over yet. So I guess some of it remains to be seen.
Thanks, Erin. I'm going to turn the next question over to Meenakshi. What has been the effect of compounding mental health emergencies within the Downtown Eastside community?
Thank you, Amelia. Yeah, so I think just the kind of theme of what I'm going to bring up today is around stigma and criminalization. If you don't mind going to the next slide. This is just a really powerful quote from Métis artist Christy Belcourt, and I think it challenges some of the narratives that we're seeing in the mainstream around COVID is an equalizer, we're all stuck at home, and now it's our chance to like really reconsider the world we're in and the world we want to create. But what Christy points out is that this isn't an equalizer, it's a mirror, and what we're seeing is pre-existing inequality, injustice, greed, and the failure of governments who had people convinced the economy is all that matters, and it's shining a big goddamn floodlight on all of it. And I know this is strong language, but I think that what we've seen in our work is who's being accepted as collateral damage in the response to COVID. So I'll just briefly touch on the effects of these compounding public health emergencies. And again, I want to recognize that while COVID is a relatively new public health emergency, as you, Amelia, and Johnny both acknowledged, we're also living in the context of a poison drug supply and a public health emergency that's been going on for 4 years. And the broader systemic inequalities that can be traced back to colonization, as well as systems of oppression like misogyny, transmisogyny, ableism. All of these interlocking oppressions are really coming together and shaping what is happening in the communities that Pivot works with. So we've seen how people have fought against overlapping emergencies for decades, if not centuries. And what we're also seeing now is this coalescence in a housing shortage, a toxic drug supply, the rampant violations of sex workers' rights. There's just another fatal layer of consequences to a landscape that's already rife with injustice. And as I said before, the communities that we serve are rapidly becoming the accepted collateral damage of the pandemic. You know, on one hand, we hear about how cities are reopening golf courses and botanical gardens. And on the other hand, we hear about how police are empowered to displace people from tent cities. So I think that this really highlights the way that the lives of people who experience street involvement, who use substances, who are psychiatric survivors, are experiencing the pandemic. And I want to credit some folks, mainly in Ontario and Quebec, who have talked about policing our way out of the pandemic. And I'll get into that a bit, but we can't do that, and it will only further harm folks already facing a lot of marginalization. I'll pass it over to Chris now.
Thank you for inviting me. Where to start? How has COVID affected us in the Downtown Eastside? Lately, I've been working in the out of Oppenheimer Park, and as you guys know, there's a lot of action there. Starting last Saturday, the province announced that they would be housing people. So WARS, as well as so MBEC and the Vancouver Aboriginal Community Policing has been doing outreach there for quite a while. We've got peers that have been cleaning there, and basically, so we're kind of, it's a very tense situation that in the community right now. We've seen, once the virus started making its way, organizations didn't really know how to react, and unfortunately, without PPE out in the community, a lot of places just closed down, which we know that it's starting to rebound now. Like the Aboriginal front door, they stopped letting people inside of their small place for their services, and have adjusted by coordinating food from the front door instead. Yeah, everybody's really stuck. Kind of happy now that BCH and other groups are out there now putting PPE out there, personal protection equipment and masks, and as well as training for our outreach. So they've given us new protocols for addressing overdoses, and they've given us PPE as well, which is what we didn't have as an organization before. But in the park, there's all kinds of nervousness. We've got homeless people, which they're trying to get inside. We've got drug users, we've got drug dealers, sex trade workers, political activists, mental health workers, all with the homeless people. I think COVID has really brought us all together, and we're sort of able to unpeel those layers, and I think we'll talk about that later on. But I see this is a great opportunity to be able to get resources to street people like never before. I'm just 688 units was the number I've heard of the units that they have. There's over 2,000 homeless people in Vancouver, so I'm just waiting for what's going to actually happen once those resources run out, because there's going to be something that's left, eh? So everybody's kind of nervous. It doesn't matter who you are around those. It doesn't matter who you are. You're kind of nervous, and it's led to escalating violence. Personally, I was actually attacked by somebody in a tent the other day, and that's totally what I attribute it to, is that uneasiness. What's going to happen? There's safe supply out there. People need meals, they need food, they need connection activities just like anybody else. How would you be able to self-distance or be able to stay at home for if you're kind of used to being in the park? And so what's going to be left over after the BC Housing and the PHS move people on? We have peers that have been doing work there, like I said, for over a year now before anybody else, other entity has showed up. Those guys have all these entities all have contracts to do these things. They're paying their workers, they're hiring people, and I think that's really great, as long as what we're focusing on is getting people inside, getting those people inside now instead of later. So I'm happy that in that respect, but I feel that the peers are always left out. I feel that the First Nations people organizations and the people are always left out by the decision makers. I mean, WARS is Western Aboriginal Harm Reduction Society, is a group that provides services to people in the Downtown Eastside, and they're basically a homeless organization themselves. They share space at the front door, they share space at Bandu, they share space, and they do anything anywhere, right? So we're out there in the community, and we deserve more peer programming. We deserve Indigenous harm reduction, which is not really there. So we're all about creating that culture of well, implementing First Nations culture in harm reduction. This is what we want, is what we're looking to do. We know that at nighttime there's no services. We know that there's nowhere to use the bathroom in the Downtown Eastside, and it's been like that for many years. It's been like that since 2003. I was a Woodward squatter, and I was homeless, and that's when wars started. And so that's how long I've been in this game anyways. But thank you for inviting me, and I look forward to the further discussion. I thank you.
Thanks, Chris. And I really appreciate you kind of foregrounding what the need is and what some of the solutions will be going forward. I think that's really important to have that at the beginning of the discussion. I'll turn the next question over to Doug. How have people's legal advocacy needs changed since the beginning of the pandemic?
Yeah, interesting question. I think from our experience in Victoria, we've seen some pretty significant changes in what people are experiencing. You know, not surprisingly, when things started to really happen, and you started to see the government intervention and the government measures take effect, we kind of have seen multiple waves of what people's needs have been. The organization is somewhat unique, I think, in that we represent quite a variety of low-income clients from across the spectrum, some of whom are actually employed and are precariously employed. So not surprisingly, when the government distancing initiatives and measures were put in place, which effectively closed a large part of our economy, we saw a tremendous wave of people who, you know, within the span of a week, had lost their jobs and were in a position where they needed to try to find alternative income sources. As much as some of the benefits that have been provided are a huge help to the people who need them, I don't think anyone would fairly say that they've been rolled out seamlessly. And I think, unfortunately, for the people who are on the receiving end, what they're seeing is patchwork. They're getting one benefit on top of another on top of another. We went through a series of about 4 weeks there where it felt like every 3 days there was an announcement of a new benefit. And that's when our services became more and more needed. As you got to a point where the complication between these benefits, the provincial level, the federal level, the local level, all of the different barriers, the fact that you could qualify for one benefit, and if you did qualify for that benefit, it meant you did not qualify for another benefit. To the people who were in crisis, it was, in my opinion, somewhat unfair to put such a burden on them to understand and try to process where they were supposed to receive help from. Not surprisingly, a lot of people turned to us and asked for help in terms of navigating that field. We did a lot of work in the first 2 weeks around helping people navigate the EI system. And as soon as those applications for EI went in, that system changed and the new federal benefit was announced. So then there was a lot of work to be done about getting people to understand what would happen to their existing applications. And I guess as the pandemic rolls on, what we've seen then is a knock-on effect where was the first primary concern was people who were employed, a lot of people on disability who were employed, and navigating how that was going to impact them. Now the focus a lot more is on housing. As rent becomes due again in a few days, as the longer term effects of the pandemic hit, we're seeing a lot more requests for helping with navigating the relationship between landlords and tenants. And just this week, obviously, with the announcement from the government that there was the intent to move hundreds of people from outdoors, and I'm really glad that Chris raised this. Many of the people living outdoors have been running those operations themselves, so they've been more peer run and peer based. And the government now is trying to move those operations indoors, where they will be probably, we're not even sure yet, but probably under some level of operation from the nonprofit sector. So we're seeing a lot of requests now for support and advocacy on that transition and what it means. And it's really, really hard to do because we haven't actually been given much detail about what the rules will be, what people can expect if they move inside, if they move out of the homeless camps. And I think, unfortunately, what we're seeing in this pandemic is a lot of the issues that we've seen over the last 10, 15 years scrunched into 5 weeks. You know, we've had multiple tent cities now in the province that have spanned out over the course of months and months. Now what we're seeing is tent cities rising and being vacated in a matter of weeks. And you can only imagine what kind of impact that has for the people who are actually living in these cities, for people who suffer from mental health and addictions. All of that stress and all of that that difficulty that has been traditionally spread out over long periods of time has now been sandwiched in these very short weeks.
Thanks, Doug. I think we can now dive into some of the specifics around the supports are being rolled out. The next question is for Aaron. We've seen income and disability assistance get bumped up with crisis supplements, and there's some exemptions for people with disabilities who are eligible for federal benefit programs like CERB. How have these measures provided financial support, and are they sufficient? Have they prevented loss of income for people who are receiving income assistance?
Right, so I'll start with the good. That's so the financial supports the government has recently introduced to help people through the emergency, and there's lots that we've been really happy to see. So on the provincial end, as you just alluded to, the government just announced several measures for people on income assistance and disability assistance, or PWD as it's known. And I'll run through those really quickly for those that are less familiar. So first, employment insurance and the new Canadian Emergency Response Benefit, or CERB, are temporarily exempt from clawback from income assistance and PWD. So that means if you're eligible for EI or the CERB, it won't be deducted from your monthly check. For those on income assistance or PWD that aren't eligible for EI or the CERB, the government is now providing a $2 supplement each month for the next 3 months, and that started with the April 22nd check that was just issued. And then for as long as transit fares are suspended, if you were participating in the bus pass program, you'd start receiving the $52 a month transportation supplement on your check instead. And then the ministry also temporarily has opened up the emergency disaster supplement. And I think that's one that people have heard less about. It's now available in addition to regular crisis supplements. So people who are receiving income assistance or PWD can apply for that on an as needed basis for unexpected COVID-related expenses that they can't afford to pay. So just to be clear, you need to apply for that benefit. It's not something you'd automatically receive. And then just in terms of the new federal CERB, we're really happy that the government's exempting that from clawback from income assistance and PWD, and that's definitely something we advocated for. It's a significant benefit if you're eligible for it. Just really, really briefly, it's a temporary federal income support for eligible workers that have lost employment or self-employment because of, employment or self-employment income because of COVID-19. And it's a taxable benefit of $500 a week for up to 16 weeks. So again, all those benefits are really great to see, and we're very happy that they were introduced. Those are really going to help a lot of people meet basic needs in the coming months, as well as added expenses that people are seeing right now, like having a stock of food in the house, extra cleaning supplies, PPE and medical supplies, and delivery costs that people might be encountering right now. But the question was whether these benefits are providing people with adequate financial support right now. So first off, I'd say that many of these benefits should be available in regular circumstances and shouldn't be stopgap crisis supports. So taking, for example, the $300 provincial COVID supplement, even with that $300 and PWD are still just $1,483 and $1,060 per month, respectively, which is still below the poverty line. So for some people who are receiving those benefits, they might be able to afford basic necessities for the first time in a long time right now. And that's something that people shouldn't be experiencing for the first time during a pandemic. Like that's something that we should expect from a social safety net. And inevitably there's some people that are falling through the cracks and some gaps in supports that we would like to see addressed as well. So first, I'm thinking of provincial benefits. It's important to note that those benefits are only available to people who are already receiving income assistance and PWD. So as far as we know, there hasn't been a move to fast track people through the disability assistance application process. And in fact, some people are experiencing major barriers in applying for PWD right now. It's really hard to get in to see doctors and other assessors right now to get those forms completed. So that's been a major issue we've been seeing. Also, like for people with substance use disabilities, many of those folks tend not to be approved for PWD because the application requires that a doctor confirm that your disability is likely to last for at least 2 years. And sometimes it's difficult for someone to find a doctor to confirm that on their application form. So it's important to understand that not every low-income person with a disability is receiving these extra supports right now. And in that vein, another major gap in supports would be people who receive federal disability benefits right now, so CPP disability and not PWD. As of yet, neither level of government has introduced emergency financial benefits for those folks. And we'd like to see something along the lines of the $300 COVID supplement for people on federal benefits as well. And also we were quite disappointed to see that people receiving income assistance and PWD aren't eligible for the new provincial temporary rental supplement. And just one other thing, as for the CERB itself, there's definitely some gaps which the federal government seems to be addressing incrementally. So I'm thinking there, for example, of the recent expansion of CERB to include part-time and seasonal workers, as well as the monthly benefits that were announced last week for post-secondary students and recent graduates. So it's been nice to see those addressed, but as Doug said, it's been difficult to keep up with the benefits as they're changing. And we do hope the government will continue to address remaining gaps and make sure that people have these emergency supports and that they're actually there as long as people need them. And just as one final note, I'll just say that it's been interesting to see the federal government declare that $2,000 is the minimum someone would need every 4 weeks in order to get by. So I know as advocates, a lot of us hope that this is going to prompt conversations at both levels of government for what constitutes adequate social assistance, even after this crisis passes.
Thanks, Erin. I'm going to turn it back over to you, Doug, to look a little more at the housing policy changes that have come about. We've seen eviction freezes, rent subsidies to landlords, and a pause on rent increases. So similar question, are these measures adequately addressing housing insecurity? And what could be done differently to ensure people maintain their housing during and after the pandemic?
Well, I'll start by maybe saying it a little more bluntly than Erin would. I actually think if you look at the differential between what the government has essentially provided for people on disability and income assistance versus what they've provided to those who have become recently unemployed, it's essentially confirmation for what a lot of those people in those communities have already been saying, which is that they're treated as essentially lesser by the government. They're expected to do a lot more with a lot less. And whereas the government is essentially saying, on the news, we think the minimum that people are going to need is $2,000 with rent supports on top of that. We continue to expect people on income assistance and disability to survive month over month, year over year on much less than that. So I also hope that one of the things that comes out of this is more reflection and a kind of a hard conversation about why those two standards exist. But at the same time, I'm not holding a lot of confidence. A lot of the kind of deeper conversations that really need to be had, especially around things like a basic income. We see those conversations sparked in other countries. I know specifically Spain has already started a very in-depth conversation about whether or not they need to move to basic income as a result of this crisis. We're not seeing that movement here in Canada yet. So in terms of housing and the initiatives on housing, I can say I think probably the eviction moratorium was one of the biggest changes that was brought in. A lot of these are really, really, really positive measures. And I think also kind of what was touched on earlier, it's really interesting for people that work in our field and for people that do legal advocacy and work in poverty law, because so many of the things that the government introduced over the last 6 weeks are exactly the things that these organizations have been calling for the last 10 years, almost to a T. A lot of the policy changes that people have been asking for, safe supply being the perfect example. The roadwork was already there because these organizations and the individuals themselves, the drug users and people who work for those organizations have been calling for it for so long. The government knew exactly what they needed to do. And I think the toughest question out of all of this is now that we've done it in the middle of a pandemic, why would we change afterwards? Why would we change what we've done during this period to make people's lives better? Why would we take it away from them when the pandemic is over? Some of those I think are going to be harder to look at than others. We fully anticipate that the measures that have been changed in terms of housing will probably be rolled back, and that's really a shame. A couple of them that I'll talk about now, I think are really, really positive changes that will help us in the long run, especially in shaping public policy. So the announcement on evictions, the moratorium on evictions, wasn't actually a complete moratorium on evictions, and we've had a couple of these where the announcement doesn't necessarily meet with what the actual legislation that follows it is. In this case, the moratorium has a gigantic loophole to it, which is that a landlord could still actually apply for an eviction. A landlord can approach the residential tenancy branch and say, in circumstances where they believe their property or themselves have been put at risk by their tenant, they can still try to evict somebody during the pandemic. Not only is that a hole, but I think it also invites landlords to challenge the system more and to ultimately not send the message that really should have been sent, which is that nobody should be losing their home during a pandemic. We at our office have already started to see cases where landlords have either tried to evict people during the pandemic or tried to ignore the measures brought in by the government, continuing to issue eviction notices. And in the worst case scenarios, landlords who are deciding to just circumvent the system entirely because they don't believe the system now meets their needs. And we're starting to see those illegal evictions occur. So there are a lot of changes that obviously bring a lot of positive change, but we're still dealing with a government system that effectively leaves it up to the tenants to advocate for themselves or with the help of an agency like ourselves. And ultimately, they're responsible for enacting their rights. The government is not going to step in and protect them necessarily. It's still a reactive system where the tenant is the one that must initiate some kind of procedure to fulfill their rights. One of the other main measures that we've seen in terms of tenancy was the rental supplement and the suggestion that obviously if a tenant is not able to make their rent in any month, that the government could top up that rent. Obviously that's another positive thing that we see, but then when you look deeper, you see that power dynamic come back again. You're still in a situation where the landlord is actually the one who gets the money directly, who is the one that facilitates the application. And we've already started to see cases where the landlord starts to pressure or coerce the tenant into making an application for that additional money, even if the tenant doesn't necessarily qualify for it. And of course, in those kind of circumstances, you're also seeing situations where the landlord is putting an ultimatum on the tenant. If they don't make that application, then the landlord may take action in certain forms against them. So it was never a perfect system to begin with. And I think some of these measures are meant to push things in the right direction, but we're still dealing with a system that inherently has a very, very strong power differential between landlords and tenants. And not surprisingly, in a pandemic, that's been exaggerated. The other thing that I really, really want to highlight is that we don't still seem to have much of a plan for when this ends. A lot of the measures have been basically putting it down the road. We're talking about, tenants not having to pay their rent and not being evicted because of it, if that's their situation. But there's still no measures in place for what happens when the pandemic is over or when the state of emergency is lifted, and what happens to tenants if they have an amount of rent that's overdue. We're still a long, long ways away from knowing how we get out of this situation.
Thanks, Doug. I'll turn it back over to you, Chris, to kind of follow up on some of your earlier comments with regards to what you were seeing in Oppenheimer Park and with homeless residents in the Downtown Eastside. How are shelter spaces adapting and supporting people to follow public health advice? And what additional supports do homeless residents need to protect themselves and others during the pandemic?
Great. I'll start with a little bit around what I've seen at some of the shelter sites. Like I had mentioned before, a lot of the organizations were responses where they couldn't protect their workers. So until they got PPE, until they got training, and that was when they were able to open their doors. But and really, I've only seen them just open their doors. To me, it seems like all the services are still being delivered to people from the sidewalk at UGM. They're serving meals there. I'm just assuming at nighttime when they open their space, that's when they let people in. But like the gateway, the Powell Gateway, which serves street people, they don't let people into their building unless they need the bathroom, basically. So they're allowed to use the bathroom. I'm not sure if showers are going on still, but I know everybody that I've been talking to say that they need to do laundry. In like around Oppenheimer Park, there's no bathrooms that are open. They've been broken down for weeks. The parks won't open them. They've been broken down lots, and that's because they've been vandalized. And that's why we would like to have organizations that are there to monitor those things like bathrooms, so people don't die in outhouses. So when they're experiencing problems, that there's somebody there that's knocking on the door and just asking, hey, how are you doing? We used to run a bathroom program at Maynard Hastings years ago with PHS, and they had taken the doors off of the bathrooms, the outer ones, just so that you can keep in verbal earshot of people and keep people moving. Eh? So when nobody's paying attention, that's when bad stuff happens. Eh? So services have changed. It's not for the better. Homeless people and street people have less and less places to go. They're out on the street now. That is the places where they go to sit down, because you're not allowed to sit inside now. You're not allowed to go into social housing or supportive housing to visit your friends, which also leads to talking about those overlapping pandemics. People are still overdosing in SROs and in hotels. So the Patty Daly said the other day that they should lift those things now, right? That the overdose crisis weighs more heavily right now, so they should be letting people in, so that if they're going to be using drugs, they should be using together, or create online platforms and get technology to people that use drugs. A little off of the topic, but that's what they could do. So BC Housing and the province has stepped up, and they've got those units, certain amount of units, 688 for the Vancouver area. So what's going to happen when the remainder, the 1,400 people that are still looking for a place to live? They did have a tent city, Oppenheimer Park, and this is what the battle has been all along: was how do people protect themselves while they're homeless? How do they protect themselves from the virus? I think that we're going to have to look as a city or as society. We're going to have to create these open spaces where, like a tent city could comply with public health, could comply with having services there, showers, hygiene. So, because that's going to be staring us down really shortly after, once this colossal effort to getting people inside, there's still going to be something left. What is it going to be? And really, that goes to the public, and it's Canada wide. As soon as this happened, I started going around. I took pictures of hotels that are no longer have tourists in them, that are empty now. And I've talked to staff, and I talked to hotel owners, and most of them are not keen on housing the homeless people in their places. So that's the same sort of thing that's going to be across Canada. People are not going to want to help. So I think it's going to come down to, hopefully, that the province there could be a provincial health order that could compel businesses to incorporate the homeless people into, or street people into their places. I think that is in order now. But there's not a lot of sanitation in the Downtown Eastside. Nobody has showers, has access to showers. Nobody has access to bathrooms. Beyond this pandemic, it's all, there's still going to be lots here. I like the opportunity, or I like what's happening. People are getting housed now, but I'm really concerned with, so since the virus came out, homeless people are now, instead of in the back streets and in the parks, they're out on the main streets. They're in the tent in parks. They're really up front now, eh? So they've taken the place of the public that used to walk around. And yeah, it's just the balance of how do we get everybody inside now, or support everybody. And I think it's going to have to be more than what the province has laid out now. City Council is going to be forwarding a motion today about Jeannie Swanson, about how do homeless people comply with the public health orders, and it's about getting more hotel rooms. So I hope the public can just weigh it out in their mind and say that this is for the public good. Everybody deserves to get away, or to be not in harm's way. It was before the virus, and they deserved that before, and they deserve that now. Thank you.
Absolutely. Thanks, Chris. I think a lot of your comments, and Aaron and Doug, your comments point to the health inequities that exist and the systemic inequities that exist, and also the ways that our policies are being designed. Stigma is clearly still embedded within that process. I'm going to turn the next question over to you, Natki. Can you explain what a stigma audit is? How could the BC government audit their COVID-19 response to stigma? Your mic may be muted.
Darn, because what I just said was so brilliant, but I'm going to try and recap it. But I want to just reiterate what Doug, Aaron, and Chris have all said around the impacts on communities and unintended impacts. So I think a stigma audit starts at what are the unforeseen consequences of public health guidelines? So for example, when we heard about the social distancing of social service and healthcare workers, what did that mean for folks who were living in public space or relying on those supports? When we heard about the border closures, what did that mean around access to the illicit drug supply? What does it still mean because safe supply hasn't rolled out adequately? Closures of libraries and community centers, that meant like the loss of a lot of access to digital technology. So people who may be street involved then lose the ability to communicate with friends and family. And all of this, creates like a very real sense of desperation and fear in communities that are already underserved by things like print media. There's not a lot of like newspapers around, right? Even before the pandemic. So how are people able to access even up-to-date information about COVID-19? As Aaron and Doug spoke about benefits like CERB, what we heard is those benefits didn't adequately foresee supports for people who participate in informal or criminalized economies. And that's things like sex work, but also street-based vending, people who rely on stipends and honoraria, how they were not remembered in the mass federal response. And the last thing I do want to point out is the very real fears around like any type of criminalization or incarceration right now. We have a massive outbreak in BC at the federal penitentiary in Mission, but people are also concerned about all forms of detention, including psychiatric detention and the public health risks that are not unique to Canadian federal prisons, but really any carceral setting. So a stigma audit would essentially enable government and policymakers to consider these unintended consequences. If you go to the final slide, Amelia, there's the image. Yeah. So this is an image taken from Project Inclusion, which is a report that Darcy Bennett and DJ Larkin worked on. It was published in 2018. And a stigma audit, I think, is most useful when it's done in conjunction with people who are most impacted, folks with lived or living experience, who ideally would have been at some of these decision-making tables prior to the rollout of benefits or policy responses, so that they could really highlight what does it mean when you're going to close every community center and park in the city, and how will that unintentionally impact people who rely on those computers to communicate with family? What does it mean when you create a mandatory evacuation order that's going to be enforced by the police? How is that going to particularly impact people who rely on public space and have been sheltering in a tent city for many years and are now concerned about police enforcement? So a stigma audit is really a tool to look at the knowledge gaps, prejudices, and labels that underlie law and policy responses. And I mean, the stigma audit really, I think it's a tool that's applicable to all things, including our own work at Pivot, right? How do we continue to work with directly impacted communities when we know that not everyone is equipped for Zoom calls? How do we continue to maintain those relationships, even as an organization, so that our advocacy reflects the needs of folks who are most impacted? I think that's what I'll say about stigma audits. And again, these resources can be found on our website. And if folks want to take a look there, I'm happy to follow up.
Great, thank you. Since we're running short on time, I might actually just turn it over to audience questions. And one particular audience question, which I'll ask each of you to kind of give a short response to wrap up the webinar. They asked, how can we encourage real progress and material support after the pandemic so we don't go back to an unequal society? Erin, I'll turn that first to you.
I think it's a really good question. I mean, I think it's something that hopefully, as more people are experiencing how quickly they can find themselves in need of financial assistance, there'll be a more compassionate eye to what social assistance should look like. And I mean, I'm not sure what that means to each individual person in terms of translating that into political action or advocacy efforts, but I do hope that that means that there'll be broader support in the community for a better social safety net.
Great, I'll turn it over to you, Doug, to give your thoughts.
Yeah, I definitely agree with that sentiment. I mean, I hope that for a lot of people in our society, it's a bit of an eye opener of how unprepared we were to handle this. And I think that same kind of reflection needs to happen within the nonprofit sector as well. A lot of people are going to look back and say, how could we have done better? And I think, when I look at a lot of the policy changes that have been brought up, I see a lot of the value in the nonprofit sector because I see so much of what we've been calling for reflected in that. And absolutely, a lot of the agencies that have called for these over the years are going to do what they can to ensure that that continues on after the pandemic is over. At the exact same time, a lot of criticism, I think, can be laid on the nonprofit sector for the actual delivery of services and essential services. The government deemed the nonprofit sector, most of us as an essential service, but the reality was when the pandemic hit, just as government did, the nonprofit sector for the most part looked to kind of exercise a lot of the privilege that it has, and it closed itself off from client contact because of the risk associated with it. So one thing that I hope comes from the pandemic is not just the policy changes, but a real conversation about how we actually deliver services to marginalized communities and to the vulnerable population, and whether or not what we've done over the last 15 years or so, which is really download so much of that responsibility to the nonprofit sector, there needs to be a real analysis of what are the deficiencies are of that system, some of the difficulties that lie with it. And ultimately, you know, that conversation has to include and actually be directed by the people who are the recipients of those services. We can talk a lot about policy, but at the end of the day, if we're not listening to the people who were really put into the vulnerable position during the pandemic, then we're not going to make any substantial change in the long run.
Thanks, Doug. The peer voice is so important. Chris, I'll turn it over to you next.
Great. Thanks. Policy-wise, it would be great to see like all of these things translate into more things like safe supply wise. We're going to need it for longer than an interim measure. We've been waiting for stimulants to be included in that list of safe supply forever. So it's great news that they've started it. It would be great news if doctors and pharmacies started reading actually the guidelines and the way that it's supposed to roll out. Maybe adapt safe supply to include alcohol and cannabis and other substances. Cannabis users need cannabis to be able to self-isolate as well. We've been giving out medicine twice a week in front of Vandu for a couple of years now, and all throughout the pandemic, we've still had 250 people lining up to get that medicine. We didn't stop. So hopefully safe supply will be augmented, and perhaps doctors could get on board with more natural substances like heroin directly, or cocaine directly, or alcohol directly, or more natural substances. That would be, First Nations would like that, I'm sure. For housing wise, it would be great if we could create tiny home communities. Canada is nothing but land. It's nothing but First Nations land. So it would be great if the government could figure out how to share it with us, and they could share it with us by creating a First Nations land authority and open up tiny home communities for people. I'm just thinking if we get people out of the cities or out of SROs, even into those tiny home communities, then it would free up housing in some of the more dense places. But thank you.
Thanks, Chris. And Meenakshi, I'll give you the last word.
Okay, thanks. I'm going to unmute myself. So I think, yeah, just echoing what everyone before me has said, I really want to echo what Chris has emphasized as well. And I think about the words of like Dean Spade, a legal scholar who talks about the idea that social justice trickles up. And I think that our response to COVID-19 and the crises of a tainted drug supply, colonization, could have been so much stronger if we had actually gone to the most impacted communities at the start, and not left them to kind of filter through the margins and figure out, how do I get on CERB? Like, I really wonder what it would have looked like if we had designed federal bailouts for people who were criminalized, who were incarcerated, who were at risk of police brutality, who were sex workers working in an informal economy. What if we had started there and then spanned out? I think that we could have had a really different response. And I agree, it is an invitation for us to reimagine the kind of society that we want. And absolutely, that society needs to center First Nations sovereignty. It's appalling that nations like the Haida Gwaii need to turn away visitors who are coming up to their territory uninvited. And, you know, I just invite everyone, if you're making noise at 7 o'clock, make that noise for the peers and for the folks who are taking care of folks in their mutual aid networks as well, for the people who have done it without getting paid a living wage, and for the people who have done it at risk of immense harm to themselves. And that's where I'll end.
Thank you so much to our panelists and to everybody who's joined. We're a little bit over time, so I'll keep the final comments really, really brief. Before everybody signs off and resumes their days, I want to again acknowledge this is a difficult time. If you or someone you know is struggling with their mental health, please do reach out to us. As an organization, CMHA is dedicated to supporting British Columbians to achieve their best possible mental health. And we've scaled up a number of our services in order to meet the needs that are arising. Most notably, and you'll see this on the screen here, we have an easy to navigate website with links to a range of resources from cognitive behavioral therapy to community counseling to assessment tools. Please do visit the website or email us at help@cmha.bc.ca if and whenever you need. Thank you again for joining today's discussion. Thank you again to the panelists for sharing your expertise with us. Please take care of yourselves and stay safe. Thanks, everyone.